Look at triceps. Shoulder front, shoulder sides, biceps. Cannot do this yet.
Okay.
Okay, so this is a leg press machine, biceps straight. Okay. And just focus on your quad, just squeezing. You're not really, again, you're not engaging your chest. So I don't want you going like this. Again, you're stretching too much. So we are at 3 weeks. I have a very special person today, and this is Ingrid. Hello. And so she is 3 weeks after surgery. And I wanted to kind of take her through her first workout. So she loves lifting weights, she likes exercising, and so it's a big day for her.
Yes.
Yeah. So anyway, I'll kind of coach her about what she can and cannot do. So we're gonna kind of go through some exercises and movements, and I'm gonna kind of instruct her on how to kind of do these things safely. And that's like the big thing for me. And I really want to get my patients back into exercising as quickly as possible. I want the surgeon to get you back in a little bit sooner than I would say the most, but it's definitely with some strict restrictions. But the idea is get that mental mind state back into the gym. I think it helps you emotionally. I think it helps you just physiologically to recover a little bit faster. So anyway, we're gonna get started. This is gonna be the Fit Doc series. So really the point of this is to specifically focus on recovery and plastic surgery and getting you back into the gym sooner than most. So anyway, let's get started. Good quick start. All right, ready? Okay, so we're going to kind of walk and talk. Okay. It's my favorite way to, as far as time. So when you first, at your 3 weeks, this is something I want you to kind of get in the habit with, is I want you to kind of start increasing your steps on a daily basis. When you come to the gym, I want you to do kind of a walking. You can do elliptical. I would keep it to like 15 minutes. Okay. 15 when you first start. Maybe the second week you can increase to like 30 minutes. Okay. Okay. I don't want you really trying to work out to the point where you're like sweating a lot. Okay. I need your heart rate less than 120. Okay. Okay, for cardio. So for you, after like a tummy tuck, it's really limited to about 30 minutes-ish with the heart rate less than 120. So I like the treadmill. This is my favorite thing to do. So I would normally increase it to like a incline of 3, and then I would keep it at 2, at speed of 2. Oh. So if you have like a, I don't know, an iWatch or some kind of heart rate monitor, you kind of get a sense of your heart rate, or you can just hang on to the thing, it'll tell you as well. Yeah. But it needs to be a comfortable pace where you can pretty much play on your phone, you know, and not fall off, but you're also moving. So the idea is when you kind of get your circulation increased as far as your perfusion and get you ready for the workout, which is going to be after like 15 minutes. So we're going to do this for like 15 minutes, and then we're going to head over to some upper body stuff, and we'll do a little bit of upper body stuff. Okay. You excited to move some weights? Yeah. One of the questions I get a lot is that, especially from athletes, when they talk about these surgeries they want to do, and they're like, I'm going to be out of the gym for like 8 weeks. It's just, like, it's not that bad. Yeah. And they're like, I'm going to lose so much muscle. No, you won't. Yeah. I guarantee you you're not lose muscle during your recovery. It's just what happens is that you lose a little bit of cellular fluid within your muscle cells. Your muscle cells don't die. They just get a little bit deflated because they're not being stimulated to work out. Does that make sense? So it comes back really quickly. Your strength comes back probably the fastest, but then you start kind of filling out again, and you really start kind of getting back to normal. Yeah. But it's not something it's like a life or death thing that I have some athletes come in, I can't take off 2 months, like I can't work out for 2 months, and I'm freaking out. I get this question a lot, when should I do cardio? And the answer to that is really, what's the point of your cardio? Are you trying to like lose body fat, or are you trying to, you know, are you prepping? Are you losing body fat for that purpose, but you're trying to maintain muscle? Yeah. There's kind of a reason why you're doing it, right? Mm-hmm. So people just, you know, don't work out and they just want to lose weight. Fasted cardio. Like, you walk for an hour a day. Yeah. Like, you will definitely lose weight. There's no doubt about it. Yeah. If you eat the same, right? Bodybuilders is a little bit different. We do cardio to burn fat and maintain muscle. We got to maintain muscle. So if you do fasted cardio and you go straight into training and you don't have any glucose in your system, right? You don't have any sugar in your system. Your muscle is just kind of like working on nothing. And so your body will start catabolizing, which is burning your muscle to feed the basic life of your brain and your liver and everything else. Does that make sense? Yeah. You start burning your muscles, it's pointless. So you want to separate, if you can, try to separate the two. Anyway, how do you feel?
Good.
Yeah?
Yeah.
Good. How's the weight training feel?
Good. I'm used to it now.
Yeah.
I feel it a lot on my hips. That's how I felt with the binder on.
Yeah.
But I feel it a lot on my hips, so
Yeah.
it's just getting used to it. And right here in the back.
Yeah. Okay, so we're about to finish this up. There'll be 15 minutes, and then we'll head over to the weights. And we're gonna do kind of mostly like upper body kind of stuff. I'm gonna show you a couple things lower body you can do, but for the most part, we're gonna focus on tempo and more of the contraction, quality of the contraction versus like just banging out weights. It's a different style of training, if that makes sense.
My coach has yelled at me about tempo.
Yeah.
And so I have heard that.
Yeah. I think as you continue to lift weights, I think it will help you with safety. Like you're less likely to have injuries. So don't focus on ego lifting. Focus more on just the quality. Really kind of have that mind-muscle connection is really the secret of bodybuilding, in my opinion. Like if you really focus and not be distracted with playing on your phone or talking to other people. I'll be talking to you, but trying to really focus on the movement. Then I think the quality will be a lot better. Okay, all right, we're done. I think free weights you can find 10 pounds pretty much anywhere in academy or something like that, or even at home. You can find things that weigh about 10 pounds. So I think we'll do a lot of dumbbells. I got extra machines. I'll show you some things that machines are pretty straightforward for most gyms, but some people don't have that access. So we'll show a couple things on cables specifically.
Okay.
I like machines a lot because it's a lot more controlled. You can kind of it's a safer movement for the most part. Yeah. We're gonna kind of sit right here. All right. So what I have you do, let me show you real quick. So I'm just gonna have you on the end like this, and then we're gonna focus on really kind of your arms at first. So I'm gonna be doing some biceps like this, okay? And then we're gonna kind of out to your shoulders, out to your side like this, okay? And then one's to the front like this, okay? So shoulder front, shoulder sides, biceps.
Okay.
Got it? Nice good posture. You wanna sit up.
How many?
I would do 15. So 15 biceps. There you go. Okay. We're trying to get some circulation in the muscles. I'm sure you can lift a lot more. We start kind of getting some circulation in the upper body, start moving things around, okay?
Okay.
So one thing with you, we did breast surgery too, so what we're not going to do, what I don't want you to do, is I don't want you to do anything over your head. So no presses. Okay? No pull downs. We're not going to be doing pull downs. Okay? So shoulder wise, like you can do these all day and you'll get much more stimulation of your shoulders than really any presses could ever give you. Okay? That's good. Nice, good controlled movements. Perfect. So the weight trainer really hopes to focus on posture. We want nice, good posture. It's always chest up, tummy flat, and that's going to help with, eventually down the road, it's also a good thing. Ropes are fine. You can do one hand if you want, but this is a good exercise for obviously your triceps, but also helps with start kind of increasing the stabilization muscles of the abdomen and this. So I want you nice and straight. Okay, so basically a nice good chest here. Don't slouch. Chest up, arms, and then just straight down. Okay? Straight down. Quality contractions, not jerking. This is bad. Squeeze down, like come up. Nice, good quality movements, okay? So again, we're starting to kind of start light. We're just trying to get the things kind of moving around a little bit, okay? So a little bit closer. Good. Yep. Look at our triceps. Boom. Good. Perfect. So I can see that you're keeping your core nice and tight.
Yeah.
Does it feel good here?
Yeah,
good.
It does.
So I know she has amazing legs, by the way. Legs, just tons of muscle. So you're dying to do this. You cannot do this yet.
Okay.
Okay, so this is a leg press machine. Squats, lunges, it's too much. You're asking too much of the swelling for your legs. Okay, so thigh lift surgery, we don't want to cause a lot more swelling than necessary. Anything like leg movements, it's really gonna piss things off.
Okay.
I'm gonna show you some things on leg extension and leg curls that I'm okay with, but it's gonna be different kind of training. It's gonna be more isometric.
Oh, okay.
Okay.
Yeah.
Does that make sense? But no leg press, no squats, Smith machine. Okay.
No hip thrust.
No hip thrust. Okay.
I need to build my butt back. I feel like I've lost it.
Yeah. I like to, in my practice, I want to get my patients back in the gym as quickly as possible. So, just like you like to work out a lot. You're used to that. There's a mental component to it of just being in gym. It's just part of your routine. It's a lifestyle. And so people who exercise consistently, it's important to get them back to that as quickly as possible. So in my practice, I work with a lot of athletes, and so I've kind of tailored my recovery a little bit shorter and shorter as I can tolerate, but also maintain really, really, really low issues of complications like, busting incisions open or causing bleeding issues. But for me, 3 weeks is about as soon as I can get my patients back to exercise routine. So you've had a lot of surgery, but still, once you get back into it, you'll start noticing that your swelling will go away faster. And that's what I've seen, is that your swelling will go away faster because you're starting to get your body back in the normal routine of moving fluid in your soft tissue around. The muscles act like a pump, actually.
Yeah.
Your muscles help pump all the circulation through. So I think, as long as you're doing it safely, you're going to get back to life a little bit quicker.
And it makes me happy.
The mental component is actually a big thing.
That mental part of like just being happier, of like moving my body, just helps with healing in itself. So
yeah, being a hermit
I don't like
is
it.
not a good thing. So
I
that's
know.
for everybody. Yeah. Good tempo. Are you feeling things working? I can see it working. Looks good on you.
Okay.
So let's talk about things to give you kind of a little break for a second, is things you can do. So this is something you cannot do yet.
Okay.
So this is a lat pull down. And so I don't want anything over your head right now. So what it does, if you try to do this, you'll feel stretching. I'm sure at times you feel stretching already.
Yes.
This will really piss things off, okay? So.
Like even in my shower head, I can't
Right.
Yeah.
You might feel like a tugging sensation like right here, or like right here.
Yeah.
So I don't want you doing this yet. You will soon, but not right now. So I don't want you doing this.
It feels like a hard back day. Where you're just sore right here. And so like if somebody was to like hug me from the back, is where I'm like it's right in the spot.
Right.
And so.
Yeah. And this is, had you, without breast surgery, this would be okay.
Okay.
Okay? But with breast surgery, I don't want you doing this. Same thing with this. This is shoulder press. So I don't want you doing this, okay?
Okay.
And so your incision's not ready for it, and the swelling's not ready for it, okay? So real quickly, we're gonna show you a couple things with the tricep stuff that you can even do with this. You can do it with the kettlebell, but you can kind of go like this. You can go overhead like this. You use 2 hands. You do that. Okay? This is not that big of a deal.
Okay.
Okay?
Yeah.
This is very lightweight. It's really just a tricep thing. It's not like using your whole upper body. Does that make sense? So this would be okay, and if you want to do that. I don't have a whole lot of back things that you can do other than if you did something like with the bar or even dumbbells like this. You can do this like this.
Oh, upright rows.
This would be, it would be upright rows. You can do it with a straight bar, and you kind of go like that.
Okay.
So you're not really, again, you're not engaging your chest. You're not really, stretching anything. It's just kind of lifting that. So.
And then this will help with the
And
core.
great. So good. You want to try that? Do that.
Yeah. Yeah, I don't feel it as much as I thought I would.
Yeah. So you can kind of spread that into variety. You can do this, and then to the front like this, like that.
A little bit more challenging.
Yeah. You kind of start component a little bit into the shoulders.
Yeah.
And then get them to move again. We're trying to get everything to move. And that whole time you're getting good stabilization of your core at the same time, and kind of getting that to wake up.
talk about lightweight, but if you do it slow enough, it'll get challenging enough.
Very much so. Yeah, that is absolutely true.
Yeah.
I love this machine. This is a leg extension. Here, I'm gonna sit you back. I'm gonna try to adjust this for you. So, just make sure you're adjusted correctly. So, the adjustment for this is always make sure your knees are directly in line with the pivot point. Okay, so you got to make sure your hips are forward enough. If you're too far back, then the pivot point's too far ahead of you, and you'll put more strain, more on your tibialis than anything. So it needs to be at your pivot point. And if you're not, you're shorter. So and if you need to, you put like a little pillow thing back here to get a little more forward. Make sense?
Yeah.
So for you, what we're going to do is we're going to do an isometric. So you should be very rested. I don't want you doing this.
Okay.
Okay? Hands nice and rested. Nice good torso posture. And then you're going to go up and squeeze and hold. Toes up. Like this. Toes up. And you'll feel your quad activate. Okay?
Yeah.
So we're going to hold that for 10 seconds and come down nice and slow. Again, you're not doing this. You're not doing this. Sit up nice and straight. Don't lean back. Nice and straight.
Okay.
And just focus on your quad, just squeezing. So more about the quality and then nice and slow. So we'll go up. You can start with 3-second holds. You can do 5-second holds. But I would really just want you to focus on just squeezing real hard. Toes towards you, not down. You want this. Okay? That makes sense? Mm-hmm. And so you're able to focus. You can get your legs kind of moving again without like overdoing them and killing like squats and lunges and hip thrusts. Like that's just too much.
Okay.
The hip thrust for you, it would be very uncomfortable here.
Right.
So we're not going to do that.
Yeah.
Okay?
I figured it's going to be a long while till I can do that again.
So your legs here, like your incisions are not being stressed because you're not stretching them.
Okay.
Everything's nice and rested. So your incisions for your thigh lift is not going to be that. It shouldn't be terribly uncomfortable. You might feel something like little shooting pains, but that's a good thing. We want things to start kind of waking up. That makes sense? All right.
I can't really bend down for that. Yes.
Good. You sit forward. There you go. Good. Yep. Squeeze hard. Tightness here and then there. Feel it?
Yeah.
So in this exercise, you're not like really straining yourself. You're not increasing your heart rate. You're not increasing your blood pressure. It's just really focusing on this one muscle and that's it.
Yeah, you feel it all right here.
Yeah.
I do feel the pressure under my thighs of like just it being pushed up.
Yeah. But as you notice,
so, like, you feel the tightness of it.
Yeah. As you notice, every day will get better. It's going to get better every day. So at your 2-month mark, this won't really be uncomfortable at all.
Okay.
Yeah.
Just in like the past 3 days, I've seen such a big difference.
Yeah.
In like my healing every day.
So the point of this is not to like train, like get heavy. It's more about we're just getting your muscles to start working again and getting used to the idea of getting circulation and just tension. Like, so it's not, you don't need to do like 100 pounds, just stay light, holds, that's it, okay? So we're not stressing your core, we're not increasing your blood pressure, really important. So when you weight train, I do not want you sweating. Okay, so you need to be inside and air conditioned, nice and cool. Good, all right, you can be done with that. There's a sitting one, right, for curls, leg curls.
Oh, yeah.
So that's the one I prefer you on. They don't have it here, they have the lying one. I don't want you on the lying one. This one here, it's my favorite leg machine, but you can't do it yet, all right? It's just not gonna work. So it's just pressure points just too much on your tummy tuck incision.
I can't lay down forward or on my stomach yet.
Right.
Right?
Right. So this one's off limits right now.
Okay.
So if you can do the leg curl machine, again, the same posture. You're gonna be just squeezing your legs in, nice and holds. Okay. So you can start increasing your intensity of like the weight, or you can change your tempo. Like you can do like maybe 10 holds, and then drop that, and just do like short pulses, like at the very bottom versus at the top. Does that make sense?
Yeah.
I'm sure you feel your legs starting getting a little tighter, huh?
Yes, I do.
Feels good, right?
Yeah. I can like
that's
feel
called the pump.
blood. Yes,
The
I can
pump.
feel the pump already. I'm like, they're there.
Yeah.
A little bit, even with the swelling.
Yeah.
But no, yeah, I literally feel the blood.
It's good stuff, right? Awesome. So a lot of women want to know, like, what can I do with like my glutes? Because everyone feels like your butt's going out. So
Yes.
probably the one thing I would say that's maybe about the closest thing you can get to doing is something where you you do this, okay?
Okay.
With like a band or this thing here,
Okay.
you know?
Uh-huh.
So I don't want you going like this. Again, you're stretching too much. But if you just kind of focus like this and you come out at an angle just out like that, you're going to get your glute
Side
and a little bit your tie-in. So does that make sense?
Okay.
So
On the cable machine or on like a band?
you can try cable, but I would start here, without anything first and start kind of getting the movement right and then feeling like where you're feeling the movement and if you're hurting anything like that. So let's try that. So I'm going to have you here like this and it just can go out like this and then squeeze your glute here. Okay, just like that. So it's not straight back, it's just off the side just a little bit.
I'm still numb there.
You should be, yeah.
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 I know I'm still numb, but I can feel the shake.
Yeah.
Of, like coming back down.
Yeah. A lot of people have this misconception you need to do like a lot of weights to get good circulation and blood flow into a muscle, and you just don't. Mm-hmm. It's more about the quality and the tension that you have on it.
Yeah.
So you start with this, and then if you want to try some cables, do a little cable stuff, and you can add a little bit of weight. Bands are awesome.
Bands.
Right? And
Okay.
if you have any bands,
yeah.
you put the band on your front foot and this one, and just kind of go like that, and you can really, 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 really get a pretty quick, good workout. So you shouldn't feel any tightness like anywhere right here, right?
No.
Yeah. So.
I
good.
feel it all right here, even though I'm numb, but touching it helps.
Yeah. So just this exercise alone, you can get a pretty good glute workout pretty quickly. Mm-hmm. Again, you're not doing like the complex exercise like squats and that kind of stuff.
Yeah.
And this is like one of those things that people don't quite fully appreciate the things that bodybuilding has helped me in my practice. It's helping people get back into training. Is that a lot of things that we do as bodybuilders, I think, because it's just so controlled and hyper focused, you can bring that into patients' recovery and then help them not hurt themselves.
Right.
First and foremost, right?
Yeah.
But they're able to kind of get back into more of the routines a little bit quicker than most.
I can feel it.
There you go.
Yeah.
There's only like one set.
Literally.
So kind of the core things about when you first get back into it and you start this weekend is do not overdo it.
Right.
Promise?
I won't.
Don't overdo it, okay? The urge is going to be strong in you, girlfriend. I know.
I know.
Just don't do it, okay? So we really want you to limit the first week. Let's do 30 minutes of weight training.
Okay.
And we're focusing on quality. So focus and hold like that. Hold. So you feel tight. There you go. Start focusing on really getting that quads. There you go. And if you want, you can split your cardio like in the morning or in the afternoon. I don't really care. You can do it together and if you want, but just, I don't want you
30
doing...
minutes?
Huh?
You said 30 minutes?
I would limit to like 30 minutes at a time.
Okay.
Yeah. But again, very at a low intensity. Point is not to sweat.
And only elliptical and treadmill?
For you, yes.
Okay.
Mm-hmm. So variations, just show you real quick, is that variations of this. Is that, again, you only change the weight, but you can come up real quick, and then come down halfway, and then come back up. Down halfway, come back up. Down halfway, come back up. Halfway, come back up. And then come down all the way. All right, and then come up halfway, down, halfway, down. That's it. So it really changes the intensity of a muscle, and it doesn't. You don't need to kill yourself with the weight.
Right.
I love that Peloton over there. I'm a big fan of Peloton, but for women who've had tummy tucks and or thigh lifts, Peloton is not good.
Really?
Can't do it yet.
Oh,
because you're sitting down like this, and it's just too much for the core.
Yeah.
If
That's
you just
why I had asked about. I was like, just treadmill and elliptical.
Yeah. Breast surgery, and if you only did breast surgery, then I would let you get back on the Peloton. Okay. And then probably step mill too, but with the combination of two, you're a little bit more restricted. But nutrition-wise, we talked about protein. You need to increase your protein by another 20-25 grams a day.
Yeah.
Okay. So just you need all this protein, and you need water to help with the cellular metabolism, for the reconstruction of all the scar tissue and swelling recovery. So do not ever be in a deficit when
Yeah, we're not.
you're in recovery phase from any surgery.
Yeah.
Okay.
Even in the few days where I already increased my protein, I can tell a difference.
Yeah.
And like, that's probably why I'm like, the past few days have been great because it's all working now.
Yeah.
But
The lymphatics of the surgical area has been completely demolished. From the surgery, I just completely scraped everything.
Mm-hmm.
So your body's figuring all that out, reconstructing all that. That's why the swelling is so profound the first week.
uh-huh.
But at 3 weeks, your body's starting to kind of reconnect all the lymphatics together again. So when you work out again, you're increasing the circulation in there. So you're gonna get a little puffy and swollen right after the workout. Okay.
Okay.
Don't freak out. Okay.
Okay.
It's just normal exercise physiology, increase the circulation, just lymphatic recovery.
Right.
Every time you work out, you'll notice a little bit better. Every time. Okay.
Okay.
But that's not mean to stop. You need to continue. Just don't kill yourself.
Mm-hmm.
Right. If you try to go do hit a workout on the 90-degree humidity of Houston, you're going to feel terrible. If you go watch a Astro baseball game when it's like 9 degrees humidity, you're going to feel terrible.
Yeah.
You'll feel it.
Yeah.
Okay. So you just understand that it will get better with time. But I think the exercising and the muscles, moving and contracting, it's kind of a pump concept. So what it does, it helps stimulate the body to all right, we got to figure this out. Let's get the lymphatics recovered. Let's get that swelling out. Okay. And then going, aside to that, is that you'll notice you're always more swollen in the evenings versus the mornings.
Okay.
Have you noticed that?
I have.
Yeah.
Why is that?
Because of just normal life activities. You're walking around, you're eating, you're drinking water, and so over the course of the day, and for people who go to work and they sit in an office job all day, you'll feel it right here. You're wearing this tire of swelling. You'll feel it. It's just very uncomfortable, and it's always worse in the evenings.
Yeah.
So
which is why I do feel better after I work out after work. Because I'm sitting down all day at work.
Right.
And so then.
So you feel in your back, right?
Mm-hmm.
And you kind of feel collecting right here, right?
Mm-hmm.
So it's just because you're sitting around. So during the day, and if you
just
can,
feel heavy.
stand up every hour, walk around, walk to the front desk or walk to the bathroom, and go just do something to help with that circulation kind of flow out. Mm-hmm. Does that make sense? Mm-hmm. So, but again, that phenomenon is going to get better every day. Every day. Your lymphatics are regrowing, and your body is figuring out how to take care of it. All right. Well, that's it. That was your 30 minutes. It went by quick, huh?
Yeah, it did.
Awesome. What do you think?
It's good.
Feels good to kind of moving?
Yes.
Yeah. So so tomorrow, and if you want to train, do that again. Just I trust you know what you're doing in the gym, but try to focus on your shoulders, focusing a little bit on your arms.
Yeah.
Always, I want you to wear that to kind of maintain your posture, support your core, and then leg stuff. If you have access to this, it'd be great. Same thing with the leg curls.
Yeah.
I don't want you doing that lying one. Again, this is a crunch machine. Don't do that. I don't want you doing the chest machine.
Abductors or probably not those.
No, not those.
Yeah.
Because of your thigh surgery.
Right.
Had you only done the tummy tuck, then that would be okay. I would be okay with it. But thigh surgery, we just really wanted not to stress those things. Okay.
Okay.
Good. Questions?
I'm trying to think of what else can I do. Step ups.
So step ups, no.
Okay.
So I don't want you hyper extending your hip. Okay.
Okay.
So this is going to be you'll cause a lot of problems here at your hip joint where your incision is.
Yeah.
But also for your thigh lift as well. It'll be uncomfortable. That's why you can't do step mill either.
Yeah. Okay.
But at 2 months, we'll get back to that. We're almost there. It goes faster than you think, hopefully.
Okay, cool. No, this is good. I'm excited to be able to move a little bit.
Yeah.
Yeah.
High five.
Thank
Good
you.
job. Awesome.
This is
First workout
exciting.
in the books.
Yes. No sweat.
No sweat.
No sweat.
When I see you at your next visit, at your 2-month visit, the idea is to get you back for pretty much 95% of what you normally do again.
Just like I said, the past week has been every day. I'm like, I can do this now.
Yeah.
Like the day I could put on my own socks was like a big deal.
Yeah.
And so,
Right? The little things, right?
Yeah. Like me putting on socks, me going up the stairs. I was like, this is great. Like every day it's been like a little bit more. I have had people ask me, or many people have told me that, okay, I want to go to this doctor now. And so I'm like, I think you're the best. And so they've told me that. People have asked me how everything has gone. And like if you're actually in the room I see him every time.
Yeah.
Yeah.
That's I hear that actually more often than I thought that I would hear as a physician, that there's a lot of surgeons that just don't see their patients after surgery ever again. Like ever again. They never see them ever again, which blows my mind.
Yeah.
I just don't understand that. You know, you can't be that busy.
Even
like I'm a busy surgeon, but I'm not, like I don't understand why I would not. But there's a lot of practices like that. You literally see them the day before surgery, you do your surgery, and then that's it.
Yeah.
You might see them at 6 months maybe, but you know, little things that kind of pop up is just like, you don't, you know, you don't really get the interaction with the physician itself. Or, you know, I have Claudia. Claudia helps me a lot, you know, kind of answer small questions. But, you know, if I need to see you, I'll see you.
Yeah.
But, you know, that's a relationship of finding the surgeon for you. So, you know, I like what I do, and I like interacting with you and
you're great at it.
And helping.
Yeah.
You know, helping you, right? So that's what I'm here
Yes.
for. Same thing on Instagram. If you have any questions, just, you know, send them over.
Yeah.
You know, but Claudia, I think Claudia is probably should be at least your best friend. You know,
Yes,
anything pops up with the garments or the way, and they end up doing their surgeries, and they started kind of getting really like they really kind of come out a little bit on social media, and they turn into coaches.
Really?
They turn into like lifestyle coaches. They're
That's
training
awesome.
people and helping with nutrition. They're helping them with exercising, you know, little tricks, you know, how to manage life. Like it's really inspiring, because that's inspiring others to make changes in their life to have healthier lifestyle changes, right? So I think that's really, really cool. But, you know, you do what you want to do. But
one day, that's actually is a goal of mine, of like maybe one day like to become a coach, or to become certified at least. Like I would like to be educated in that part even more. I am so happy. I think you can tell, like I'm just like really excited. This is like my happy place, and so this is I get to be me again. I get to start moving my body. My body feels great right now just because I'm able to like move around, and I feel the blood pumping and stuff. And so, yeah, it feels good. First workout was great.